The NHS may be broken, but it's not beaten. As the report says, the NHS may be in a critical condition, but its vital signs are strong. And we need to have the courage to deliver long-term reform. Major surgery, not sticking plasters. We've got to face up to the challenges. Look at our ageing society, the higher burden of disease. And so the NHS is at a fork in the road. And we have a choice about how it should meet those demands. Don't act and leave it to die. Raise taxes on working people, or reform to secure its future. Now, working people can't afford to pay more, so it's reform or die. So let me be clear from the outset what reform does not mean. First, it does not mean abandoning those founding ideals of a public service, publicly funded, free at the point of use. The basic principle of dignity, inspired, of course, by Bevan, that when you fall ill, you should never have to worry about the bill. That is as true today as when the NHS was founded 76 years ago. And I believe in that very deeply. As some of you will know, my mum and my sister both worked in the NHS. My wife works in the NHS, and the NHS cared for my mum throughout what was a very long illness. So the NHS runs through my family like a stick of rock. But you know, this isn't just about emotion. It's about hard facts too. The NHS is uniquely placed for the opportunities of big data and predictive and preventative medicine. So the problem isn't that the NHS is the wrong model, it's the right model. It's just not taking advantage of the opportunities in front of it. And that's what we need to change. Second, reform does not mean just putting more money in. Now, of course, even in difficult financial circumstances, a Labour government will always make the investment in our NHS that is needed, always. But we have to fix the plumbing before turning on the taps. So hear me when I say this. No more money without reform. I'm not prepared to see even more of your money spent on agency staff who cost £5,000 a shift, on appointment letters which arrive after the appointment, or on paying for people to be stuck in hospital just because they can't get the care they need in the community. And tonight, there'll be 12,000 patients in that very position. That's enough to fill 28 hospitals. So we can't go on like this. As Lord Darzi has said, NHS staff are working harder than ever, but productivity has fallen because patients can't be discharged. Clinicians are spending their time trying to find beds rather than treating more patients. That isn't just solved by more money, it's solved by reform. And third, reform does not mean trying to fix everything from Whitehall. It really doesn't. When Lord Darzi says there are vital signs of the NHS and they're strong, he's talking about the talents and passions of our NHS workforce. That's what he's talking about. The breadth and depth of clinical talent, the extraordinary compassion and care of our NHS staff. If we're going to build an NHS that's fit for the future, then I tell you, we're going to do it with our NHS staff and with our patients too. We're going to change it together. Now, that starts with the first steps, the 40,000 extra appointments every week. But we've also got to do the hard yards of long-term reform. So this government is working at pace to build a 10-year plan. Something so different from anything that's gone before. This plan will be framed around three big shifts, three fundamental reforms, which are rooted in what Lord Darzi has set out today. First, moving from an analogue to a digital NHS. We can already see glimpses of the extraordinary potential of technology, like the world's first ever non-invasive, knifeless surgery for kidney cancer. Just imagine that. It's pioneered by Leeds teaching hospitals. Or the precision cancer scanners. I saw some of them yesterday. Or simply transforming how we manage a condition. We went to Kingsmill Hospital earlier this year and met a 12-year-old girl called Molly. She's using her smartphone to monitor her glucose levels, instead of being forced to repeatedly prick her fingers. It made such a difference to her daily life and gave great reassurance to her mum, who could remotely check on the settings and the findings. So we've got to make these opportunities available to everyone. We've got to use technology to empower patients and give them much greater control over their healthcare. Take an innovation like the NHS app. This could be a whole digital front door to the NHS. Appointments, self-referral, reminders for checkups and screenings, patients in control of their own data, healthcare so much more transparent, so you always know your options and the standards that you should expect. And you know, earlier this year I went to Alderhay Hospital. Many of you will know it. It's a fantastic hospital where they carry out heart surgery on infants, which is really humbling to see. And I met the parents of a 2-year-old who'd had extremely complicated heart surgery. Tiny infant, incredible surgery. I asked the parents about their child's history and conditions. How did he come to be here? What's the story behind this? And as they told me, I could see them welling up as they went through the history, the conditions, all the background. And then they told me that every time they went to a different hospital, they had to go through all of that over and over again. They really struggled to tell the story, and they had to do it every single time because the records weren't held electronically. So we've got to have fully digital patient records so that crucial information is there for you whenever you go to the NHS. And while I'm on technology, we're also going to throw the full weight of the British government behind our world-leading life sciences. Second, and Sarah mentioned this, we've got to shift more care from hospitals to communities. Now, the King's Fund has long called for this. Successive governments have repeatedly promised it. But what's happened? The opposite. The share of the NHS budget spent on hospitals has actually increased. Now, this 10-year plan has to be the moment that we change that. The moment we begin to turn our national health service into a neighbourhood health service. That means more tests, scans, healthcare offered on high streets and town centres, improved GP access, bringing back the family doctor, offering digital consultations for those that want them, virtual wards, and more patients safely looked after in their own homes, where we can deal with problems early before people are off work sick and before they need to go to hospital. And we have to make good on the integration of health and social care, so we can discharge those 26 hospital worth of patients, saving money, reducing the strain on our NHS, and giving people better treatment. And third, in terms of the shifts, we have got to be much bolder in moving from sickness to prevention. Now, we've already announced NHS health checks in workplaces, blood pressure checks at dentists and opticians. But that's just the beginning. Planning for 10 years means we can make long-term investments in new technologies that will help catch and prevent problems earlier. And there are some areas in particular where we've just got to be more ambitious, like children's mental health or children's dentistry. You know, one of the most shocking things that I saw, this was actually when I was at Alderhay Hospital again, I mentioned the heart operations, but whilst I was there talking to the staff, it became clear that the single biggest cause of children going into that hospital between the ages of 6 and 10 was to have their rotting teeth taken out. I couldn't believe it. I was genuinely shocked. Well, politicians say they're shocked too often, but I was really shocked. The single biggest cause of going into hospital, 6 to 10-year-olds, have your teeth taken out. Can you think of anything more soul-destroying? For the children, what a price to pay. For that brilliant NHS team who want to use their talents to save lives, spending their time taking out rotting teeth, something that could so easily have been prevented. And look, I know some prevention measures will be controversial, but I'm prepared to be bold even in the face of loud opposition. So no, some of our changes won't be universally popular. We know that. But I will do the right thing for our NHS, our economy and our children.